Every year, millions of people live with heart failure without realizing it. The warning signs appear long before a crisis hits, but most dismiss them as normal aging or just being out of shape. What they don't understand is that their heart is desperately trying to communicate that something is wrong, often months before any emergency occurs. If you've ever found yourself needing an extra pillow to sleep comfortably, or felt breathless tying your shoes, or noticed your ankles swelling by evening, your body might be sending you urgent messages. Before we go any further, if you find this information valuable, hit that like button and subscribe so you don't miss critical health insights that could change your life. Let's explore 13 warning signs that everyone needs to recognize. Heart failure develops gradually through specific stages. Your body sends clear warnings at each stage, but people ignore these signals because they seem minor or unrelated to heart health. Some of the earliest signs have absolutely nothing to do with chest pain. They involve symptoms that seem completely unrelated, but they're all connected to how your heart is struggling to keep up with your body's demands. This information is purely educational. If you or someone you care about shows any of these signs, you need to speak with a medical professional immediately. Only qualified healthcare providers can properly diagnose heart conditions. These signs don't confirm anything by themselves, but they absolutely should prompt you to seek professional evaluation without delay. Let's start with shortness of breath during normal activities. This isn't about feeling winded after running or intense exercise. We're talking about breathlessness climbing a single flight of stairs, walking to your mailbox, or carrying groceries from your car. Activities that once felt effortless suddenly leave you gasping for air, needing to stop and catch your breath. When your heart can't pump efficiently enough to meet your muscles' oxygen demands during physical activity, your lungs work overtime trying to compensate. Your breathing becomes labored because your body desperately needs more oxygen than your weakened heart can deliver. This symptom often appears months before other obvious signs become apparent. The key difference between normal fatigue and something more serious is the progression. If activities that were once effortless now require stopping to catch your breath, this is a cry for help from your cardiovascular system. What makes this sign easy to miss is that people rationalize it. They think they're just out of shape or getting older. They start avoiding stairs or eliminating activities that leave them breathless. And this gradual adaptation masks a serious underlying problem. If you notice progressive shortness of breath during routine activities, document specific examples. Note which activities trigger breathlessness, and when this change started, then schedule a medical evaluation immediately. Another telltale sign is needing more pillows to breathe while sleeping. This change often happens so gradually that people don't realize it's abnormal. You start with one extra pillow, then two, then eventually you're sleeping in a recliner because it's the only way you can breathe comfortably at night. When you lie flat, gravity stops helping your heart pump blood back from your legs. If your heart is weakened, blood backs up in the pulmonary veins, and this backup causes fluid to leak into your lungs, making breathing difficult when lying down. This positional breathing difficulty is present in approximately 80% of people with heart failure. Many people rationalize this change thinking it's just preference or comfort, but this specific warning indicates your heart can't handle fluid redistribution when lying flat. What makes this sign particularly important is how reliably it indicates elevated heart pressures. When you need to prop yourself up to breathe, your heart is telling you it can't pump efficiently enough to prevent fluid backup. Waking up suddenly gasping for air is even more alarming. Imagine waking up suddenly feeling like you're drowning. Your heart is racing, you're panicked, and you need to sit up immediately to catch your breath. This terrifying experience typically occurs 2 to 4 hours after falling asleep. When you're lying down for extended periods, fluid that accumulated in your legs during the day redistributes to your lungs. Your compromised heart can't handle this sudden fluid increase, causing acute shortness of breath that jolts you awake. Many people rush to an open window, desperately seeking fresh air. What makes this symptom particularly dangerous is that people often attribute episodes to nightmares, anxiety, or sleep apnea. But the specific pattern of waking up gasping for air, especially if becoming more frequent, warrants immediate medical evaluation. If you're experiencing this, Take a moment right now to like this video and share it with someone who needs to see it, because this information could literally save a life. Overwhelming fatigue that makes simple tasks exhausting is another critical warning. This isn't ordinary tiredness that improves with rest. It's persistent exhaustion that continues despite adequate sleep and fundamentally changes your daily life. When your heart fails to pump efficiently, your body diverts blood flow away from muscles, sending it to vital organs like your brain. This means your muscles receive less oxygen-rich blood, leading to profound fatigue. What's particularly concerning is how this affects exercise tolerance. Recovery time after physical activity becomes dramatically longer. A short walk that once felt energizing now requires lengthy rest afterward. Tasks like carrying groceries, climbing stairs, or even showering become exhausting. This progressive decline isn't normal aging. It's your cardiovascular system struggling to meet basic needs. What makes this sign easy to miss is that fatigue has countless potential causes. So people assume they're stressed or simply getting older. Persistent swelling in your ankles, feet, or legs is one of the most visible signs. This isn't temporary puffiness from sitting too long. This is persistent swelling that gets progressively worse, especially by the end of the day. When your heart can't pump effectively, blood doesn't circulate properly and pools in your lower extremities. Your kidneys, receiving less blood flow, start retaining sodium and water. This combination forces fluid into surrounding tissues. The swelling is present in approximately 70% of heart failure patients at diagnosis. The swelling typically starts in feet and ankles and can progress upward. You might notice socks leave deep indentations, shoes feel tight by evening, rings feel too snug. The swelling improves somewhat overnight when you're lying down. If you press on the swollen area and it leaves an indentation that stays for several seconds, this indicates significant fluid retention. People attribute swelling to standing too long, hot weather, or aging. They don't recognize it as a cardiac symptom. But when the pattern is symmetrical, affecting both legs equally and worsening throughout the day, it deserves immediate attention. Rapid weight gain from fluid retention is perhaps the most measurable early warning. This isn't gradual gain from overeating. This is sudden increase over just a few days. Your failing heart triggers hormonal responses causing your kidneys to retain salt and water. Gaining 2 to 3 pounds in a single day or 5 pounds in a week warrants urgent medical contact. Each pound of weight gain represents approximately a pint of excess fluid. This weight gain happens before other symptoms become obvious, which is why people with known heart conditions are told to weigh themselves daily. The weight gain is distinctly different from normal fluctuations. It's consistent upward movement, often accompanied by bloating or abdominal fullness. Your clothes fit tighter, particularly around your abdomen. Unlike fatigue or breathlessness, weight is measurable and provides concrete data about fluid retention. Waking frequently to urinate at night can be an early sign that's often overlooked. Suddenly needing to urinate more frequently at night than during the day reflects a specific pattern related to fluid redistribution. During the day, when you're upright, gravity causes fluid to accumulate in your legs. Your struggling heart can't effectively pump this fluid to your kidneys. When you lie down at night, gravity redistributes this pooled fluid. Your kidneys, suddenly receiving this flood, work overtime, resulting in increased urine production. People often report waking 3 to 4 times nightly, with each episode producing larger volumes than usual. The pattern is specific. During the day, despite drinking fluids, you urinate relatively infrequently. At night, you wake repeatedly with urgent need. This reversal reflects your heart's inability to handle fluid distribution properly. Before we continue with more warning signs, take a second to drop a comment below telling us which symptom you've noticed in yourself or someone you know. Your experience might help someone else recognize what they're going through. And don't forget to subscribe if you haven't already. A persistent cough, mainly at night or when lying down, is a subtle but significant warning sign. This isn't the productive cough of a cold. It's often a nagging, dry cough that disrupts sleep and improves when sitting upright. When you lie flat, fluid redistributes, potentially causing mild buildup in your lungs. Your body's response is to cough, attempting to clear what it perceives as airway obstruction. This cough is often worse in early morning hours, sometimes producing slight wheezing. Patients frequently report the cough produces little sputum, or occasionally white or pink-tinged frothy mucus, indicating fluid in the lungs. What makes this symptom deceptive is that people blame allergies, postnasal drip, or sleeping conditions. They try allergy medications without improvement, never connecting it to their heart. Feeling your heart flutter, pound, or skip beats often accompanies early heart failure as your heart works harder to pump effectively. When your heart muscle weakens, it may develop irregular rhythms while struggling to maintain adequate circulation. You might feel your heart racing at rest or experience unsettling skipped beats. Cardiac arrhythmias, particularly atrial fibrillation, are both cause and consequence of heart failure. The relationship is bidirectional. Irregular rhythms can lead to heart failure, and heart failure can trigger arrhythmias. These palpitations are often more noticeable during rest or when lying down, and may accompany feelings of anxiety. Palpitations can have many benign causes. Caffeine and stress cause similar sensations, but when they occur alongside other symptoms, they warrant serious evaluation. Dizziness or near-fainting episodes can be frightening early indicators. These symptoms occur because your weakened heart can't pump enough blood to maintain adequate brain circulation, especially during position changes or exertion. When you stand quickly or exert yourself, your body normally compensates by increasing heart rate and adjusting blood vessel tone. However, a failing heart can't make these adjustments effectively, causing temporary drops in brain blood flow. Episodes are often triggered by sudden movements, standing for long periods, or mild exertion. What makes this symptom dangerous is that people attribute it to dehydration or medication side effects. When combined with other symptoms, dizziness represents seriously decreased cardiac output. Persistent bloating, loss of appetite, or early fullness can be early signs that seem completely unrelated to heart problems. These symptoms occur because heart failure impacts your entire circulatory system, including blood flow to digestive organs. When your heart can't pump effectively, blood flow to your gastrointestinal tract decreases. Fluid can accumulate in your abdomen, and your liver becomes congested with blood that's not being pumped efficiently. Patients report feeling uncomfortably full after eating just a few bites or experiencing persistent nausea. The liver congestion can cause pain in the upper right abdomen, with some describing constant pressure making eating difficult. People attribute these symptoms to digestive problems or food intolerances, never considering their heart might be involved. Here's a symptom so specific most people have never heard of it: shortness of breath when bending forward. This phenomenon is called bendopnea, and it's shortness of breath occurring within 30 seconds of bending forward, such as when tying shoes or picking things up. When you bend forward, the position increases abdominal pressure, pushing against your diaphragm and increasing chest cavity pressure. If your heart already has elevated filling pressures, this additional stress quickly triggers shortness of breath. This symptom is present in approximately 30% of heart failure patients and is strongly associated with more advanced disease. The symptom is so reliable that researchers consider it a non-invasive way to assess heart pressure. What makes it particularly significant is its specificity. Healthy individuals rarely experience this symptom. If you notice breathlessness when bending forward, this highly specific symptom indicates elevated cardiac pressures and deserves urgent medical attention. Persistently cold hands and feet, even in warm weather, can indicate your heart isn't pumping with enough force to maintain proper circulation throughout your body. When heart failure develops, your body prioritizes blood flow to vital organs like your brain and heart, reducing circulation to extremities. This leads to persistently cold hands and feet, sometimes with a bluish tinge to fingernails or lips. You might notice your hands and feet feel cold to touch even when you're in a warm environment, or they take much longer to warm up than they used to. Your fingernails might have a bluish tint instead of healthy pink. These circulatory changes often develop gradually and can be early indicators of decreased cardiac output. When combined with other symptoms, this deserves thorough evaluation. So what should you do if you recognize multiple signs? First, don't panic, but absolutely don't ignore them either. When caught early, heart conditions are far more manageable than when they progress unchecked. Document everything. Write down specific examples of each symptom you're experiencing. When did it start? How often does it occur? What makes it better or worse? This information will be invaluable when you speak with healthcare providers. Schedule an appointment immediately. Don't wait for symptoms to worsen or convince yourself they'll go away on their own. Early detection dramatically improves outcomes and quality of life. Request a complete cardiac evaluation, including a physical examination, electrocardiogram, and likely an echocardiogram. Don't let anyone dismiss your symptoms as normal aging without thorough investigation. You know your body better than anyone else. While waiting for your appointment, focus on heart-healthy behaviors. Reduce sodium intake, as excess salt contributes to fluid retention. Monitor your weight daily to track any rapid changes. Avoid strenuous activity until you've been properly evaluated. Remember that modern medicine has incredible tools to manage heart conditions, medications, lifestyle modifications, and when necessary, procedures can dramatically improve symptoms and prognosis. Early intervention makes all the difference between managing a condition effectively and facing emergency hospitalizations. Finally, understand that having one or two signs doesn't necessarily mean heart failure. Many conditions cause similar symptoms. Only proper medical evaluation with appropriate testing can determine what's actually happening in your body. If this information opened your eyes to symptoms you've been ignoring, do yourself a favor right now and make that appointment. And before you go, hit that like button, drop a comment sharing which of these 13 signs surprised you most, and subscribe to stay informed about critical health topics that could protect you and the people you love. Share this video with anyone who needs this information, because early recognition can prevent emergencies and save lives. Knowledge is power, but only when you act on it. Your health is worth protecting.